asking our experts your vaccine questions, with more people signing up for appointments for the first dose and others waiting for their second. A lot of questions have been coming up. So to get some answers, we're bringing in Dr. Ryan Shelton with Tryon Medical Partners. He was at the forefront of the vaccine trials here in Charlotte and a familiar face here on WCNC, helping us answer your questions. Dr. Shelton, thank you for joining us. We know Tryon Medical Partners was approved to distribute vaccine when it becomes available. Do you have a timeline for when that could happen?
I wish that I did. Unfortunately, we do not have that timeline yet. So we applied to be a distributor for vaccine on the first day that we could with the state. So we were approved and are still waiting, to receive an allotment. I think the biggest challenge is just supply and demand. There's high demand and not enough supply. So we are eager and ready to help with this distribution process.
And according to the state vaccine dashboards, almost 700,000 people collectively in the Carolinas have both doses of the vaccine. How long can we expect the protection to last, and what protocols do those who have been fully vaccinated need to follow?
Great question. And the short answer is we still don't know. We hope the protection will last maybe even up to a year, but the clinical trials are still ongoing to really determine that exact time frame for the immune protection. And in terms of those who have been able to complete both vaccines, once they mark after the second dose, they should feel protected. They still need to be wearing a mask and avoiding large gatherings and doing the social distancing. The vaccine is fantastic, and it is one aspect of the process to kind of get us out of this pandemic and get us back to more normal times. But doing the basics really still has to continue for everybody.
Before I let you go, I want to ask you about the variants and how they keep popping up. We know they're in the Carolinas and they spread more easily. Are there any extra precautions we should be taking to protect ourselves from those?
Yeah, I think with the new variants popping up, which again is not surprising, that's what we expect. And we really are on a race against time to get people vaccinated to hopefully so we can outsmart the virus rather than it continuing to outsmart us. So we have to double down on the basics. We need to be doing the masking. I think double masking is reasonable. Avoiding large gatherings, doing the social distancing, washing our hands, all the things that have been working for the past year. I think it's now more important than ever to continue to master those basics. We can't get fatigued over doing those simple things that we know are still highly effective.
Dr. Ryan Shelton with Tryon Medical Partners, thank you so much. We really appreciate your voice.